Officials are trying to track down people who came into contact with a Sydney doctor who is one of the first cases of human-to-human transmission of coronavirus in Australia. Danica Giorgio joins us live now. And Danica, this is all happening as we see the number of new cases increasing just today.
Ash, just in the last hour or so, Queensland Health has confirmed that a 20-year-old man from China has been diagnosed with the coronavirus. He'd been travelling for about 2 weeks in Dubai when he returned to Australia via Brisbane late last month when he did become infected. He's currently in hospital in isolation recovering. It takes the total number of cases in that state to 10. Now, this doctor, though, here in New South Wales that has been diagnosed, he's currently recovering here at Westmead Hospital, also in a stable condition. They're trying to frantically track down who he may have come into contact with, and it's got authorities concerned because this is one of the very first known cases of human-to-human transmission in Australia. They don't know, though, whether he contracted COVID-19 from a patient, but say they are working around the clock to find those who he may have come into contact with.
That's one of the issues we don't know yet because the results only came in literally yesterday afternoon at about, I think it was 3 o'clock. So we've got a bit of a challenge. We're obviously working through it. Health is actually, New South Wales Health Ministry and the local health districts are busy talking to various people that he might have come into contact with and just making sure that we get to them and have a chat to them to make sure they don't have symptoms.
Now, New South Wales Health says that at this stage, though, they are working to find out if he was contracted via another patient or from elsewhere. Across the country, though, health authorities say that given this human transmission, that it would be impossible to think that domestic cases won't rise. But they say what they're working on right now, Ash, is slowing the spread of the virus.
And Danica, tell us more about this policy by which Australians who actually do test positive for coronavirus could actually be legally detained and also questioned under biosecurity laws.
That's right, Ash, over their travel and contact history. Now, these laws have always been in place in Australia because the federal government can ban people from entering the country. But this is the first time we've actually seen these laws expanded. They'll be backdated from January 21 when coronavirus was first listed. And what we can see now is individuals or group being banned from going to work, schools or supermarkets.
If they're refusing to do a thing that we consider to be absolutely necessary, like undergo a brief decontamination or provide information about where they've been and who they've been in contact with, or potentially provide a sample so that they could be tested for the disease, then yes, detention is an option. And I must say that power under the Biosecurity Act is actually used quite regularly at our borders, at airports, in circumstances just like the one that you've described. But I think Australians would be less used to the idea that that power might be used at a clinic that was established or at a hospital.
Now, a number of pictures have emerged on social media of supermarket shelves across the country going bare as Australians stock up on essential supplies, including canned food, tissues and toilet paper due to fears over COVID-19. But, Ash, the official advice from the federal government is panic buying is not required.